The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Good morning, beautiful people. My name is Dr. Charlene Ortiz, and today we are going to continue our lecture about stress. Today, we're going to focus a little bit more on the physical aspects of stress, whether it be because of the medical model, physical illness, and things of that nature. So let's get started. About stress. When we're thinking about stress, generally our type of personality could play a role as to how we, first of all, view aspects that could be stressors or not, and also how we cope. So let's talk a little bit more about the different types of personality that I would like to discuss today. The first one that I would like to mention is type A personality, type A personality. And when we're thinking about type A personality, I want you to think about an individual who is highly competitive, right? An individual who has a strong sense of competition. Because of that, you could expect that a person who holds this type of personality may be impatient, right? May be impatient. Notice that because of that reason, everything seems urgent, right? Irrespective of what that person is engaging in, everything seems to be, it has to be snappy, it has to be conducted quickly. And notice that because we have that perception, of course, aspects and your circumstances around you can be viewed as stressful because everything has to be conducted in a very extensive manner, very quick manner. Now, the situation with that specific concern is that generally we can be geared towards anger and hostility. Interestingly, yesterday I was talking to a patient who identifies as an elf, and we do have a little bit of delusional things going on. But yesterday, the presenting issue of this individual was anger. So we did talk a little bit about anger yesterday. And anger generally comes from fear. Anger is a secondary emotion, right? Anger comes from fear. So what are we afraid of? Well, particularly in this specific case, what we are afraid of, what we are worried about is that I cannot do things in a timely fashion, right? So the lack of control is what I am afraid of. Notice that we can also look into a second type of personality, and that is type B personality. Notice that in this particular case, we're looking almost as a complete opposite, right? Because instead of having this sense of impatience, now we're going to be an immensely patient individual, a person who seems to be amicable, right? A person who engages in amicable behavior that is easygoing. Notice that we have conducted research into determining whether or not there are some physical characteristics when it comes to heart disease and your type of personality. And it turns out there is a link, right? And remember, link doesn't mean cause, right? Just because something is related doesn't mean one caused the other, right? So for example, you're related to your siblings, but you weren't caused because of your siblings. You were caused because of your parents, right? That's how you came to be. So just because there is a link, it doesn't necessarily mean that there is a cause. But indeed, we do have a link between risk of heart disorders and hostility in regards specifically to type A personality. So any questions about that? Yes, sir. So the question was, is this clearly defined? Are you always going to be type A? Are you always going to be type B? Remember, in previous lectures, we talked about personality, and personality is simply a constant that you hold, right? A means to predict behavior, right? Notice that perhaps if I'm considered, which I like to think I'm an extroverted person, right? So notice that it's going to be relatively constant. If I'm an extroverted person, I'm that type of personality, you can't expect that. But sometimes circumstances can dictate my change in personality. So for example, maybe I'm super goofy and easygoing, like here in the classroom, I may not be in a funeral, right? So it will be relatively constant, but it doesn't mean that it can be addressed because of your circumstances, right? Because you would change. Otherwise, you would have a personality disorder. If I just start cracking jokes at the funeral and be like, haha, isn't that great? So notice that because of that reason, if a person can adapt to their circumstances, yeah, your personality and the way you react will change, but generally it is held pretty constant, right? It will, usually you will have an aspect that is predominant, right? So when I mean predominant, more than 50%. But an individual, yeah, they could have aspects of both, but a person, because it's so constant, will lean more towards one than the other, for sure. All right.